This is Dr. Eisenbrown. I'm here to answer some of your questions about the common urology problems that we see. So how do we treat stress urinary incontinence? Well, the pathology of stress incontinence is weakness of the tissue. It comes from pregnancy, vaginal delivery, hysterectomy, loss of collagen, elastin, aging, gravity working on us for decades. And what happens is the tissue gets kind of stretchy. So when you cough, laugh, sneeze, the tissue is pushed in a downward direction. The first thing I always try to explain to patients is that the vagina does not point to our heads. It actually tilts back towards the tailbone. So the pressures are not equally distributed. So when you cough, the force is in a downward direction. If you look at my hands, and the hands are the urethra, and my wrist is the bladder neck, the front wall of the urethra and the bladder are fixed to the pubic bone, but the back wall is just supported by soft tissue. So what happens is you cough, laugh, sneeze, and urine squirts out the urethra. So the options for treating stress urinary incontinence, the first one is doing Kegel exercises. Now Kegel exercises don't fix the underlying problem of the movement of the tissue, but it tightens the outer door. So for mild incontinence, strengthening the sphincter can be very helpful. The next level of things that we do is something called pelvic floor rehabilitation or pelvic floor strengthening. It is more sophisticated than Kegel exercises. I kind of think of it as going to the gym and working out with a trainer, as opposed to driving by the gym saying you're going to go tomorrow, which is what most of us really do with Kegel exercises. After that, we're talking about surgery. Something that is considered the gold standard for fixing stress urinary incontinence is something called the mid-urethral sling. So what we do is we put a hammock under the urethra so that when you cough, laugh, sneeze, that wall can't bounce down. It works very well. In the literature, it shows that 87% of people are completely dry 15 years after having the surgery done. So it works very well. Every once in a while somebody will recur, but it's generally somebody who has high risk factors, either very poor tissue, smokers, or people do very strenuous activity for a living. Or if you gain a lot of weight or lose a lot of weight. But for most people, what you get at the time of surgery should hold up for hopefully the rest of your life. Thank you for your attention, and I really hope that this has been helpful. If you have further questions, please don't hesitate to ask me when we see you in the office.